Welcome to Hints for Health, a series of podcasts covering areas and issues of concern and interest to global workers and those interested in having optimum health. Join us as we explore topics that affect most of us today and find ways to address potential challenges to your health. So let's join our hosts, Brian and Stephanie Kidman.
Today's topic involves one of the most common diseases among Americans. More than 38 million Americans have diabetes, and 1 in 5 don't know they do. Many more have what is called pre-diabetes, which means they are getting close to having diabetes if they don't make some lifestyle changes. The statistics are scary, but the good news is diabetes can be prevented or controlled. So please stay tuned as we talk about detection and prevention. I'm Stephanie Kidman, an RN that worked in education and the prevention of disease. With us today is Dr. Brian Kidman, a family practice and emergency medicine doctor that has treated many patients with diabetes. Dr. Kidman, could you please explain the diabetes disease?
Certainly. Diabetes is a disease in which the body is unable to properly use its main source of energy, which is glucose.
What exactly is glucose?
Glucose is a type of sugar that the body uses in all of its cells to provide energy that each cell needs in order to perform its functions in the body.
We all know that some people with diabetes take insulin because their body doesn't make enough. Could you explain what insulin is and what its function is?
Yes. Insulin is a hormone produced by the pancreas, which is a large gland in the abdomen that enables glucose to move from the blood into individual cells where the glucose is converted to energy for the cell to use.
And what happens when not enough insulin is produced?
If we don't have enough insulin being produced, then there's an excess of glucose in the bloodstream and insufficient glucose in the cells. Some people with diabetes are not making enough insulin, and others are producing it, but the cells resist the action of insulin and won't let glucose pass through the cell wall.
So that's why some people refer to diabetes as high blood sugar, because the glucose in the blood instead of in the cells where it is needed.
That's right.
And who is the most prone to get this disease?
Some of the people at higher risk for diabetes include those, of course, with family members that have the disease, since there's some genetic component to diabetes, but also individuals who are overweight, who don't exercise much, who have high blood pressure, and who have high cholesterol. All of these are at increased risk. Also, women who either had diabetes during pregnancy or they delivered an infant weighing more than 9 pounds are at higher risk for diabetes. And type 2 diabetes is more common after the age of 45. Now, I know that you worked in prevention with the All Women Count program. So could you explain to our listeners how you and they can reduce the risk of type 2 diabetes?
Some people are more genetically predisposed than others, but that does not mean you have to get the disease. You can lower your chances of getting diabetes by doing 3 important things: eating right, maintaining a healthy body weight, and staying active.
There are 3 important principles or pillars of good health that will indeed help ward off diabetes. Can you tell me what those 3 are?
Number 1 is eating healthy, balanced meals. Number 2 is maintaining a healthy body weight. There is a direct correlation between excess body fat and the risk of developing type 2 diabetes. As the body mass index increases, so does the risk of developing type 2 diabetes. Why is that, Dr. Kidman?
Well, fat in the abdomen organs produces fatty acid that block insulin metabolism in the liver and can reduce the insulin sensitivity in nearby tissues, which then leads to something that we call insulin resistance. Also, fatty tissue releases substances that can damage cells that line the inside of blood vessels. There was a study of over 3,000 people at risk of getting diabetes where researchers found that a healthy diet and physical activity could definitely reduce the risk of diabetes.
We should change the risk factors that we can so we can lower our chances of getting diabetes. Often diabetes goes undiagnosed because many of its symptoms seem so harmless. Recent studies indicate that the early detection of diabetic symptoms and treatment can decrease the chance of developing complications of diabetes.
What are some of the symptoms of diabetes?
Well, I have a friend who some time ago was mentioning that he was experiencing a variety of symptoms, including urinating more often than normal, being excessively hungry and thirsty, and still losing weight. He was more tired, weak, and irritable than usual, and had been noticing some blurriness of vision and tingling in his toes. And when he went to get tested, indeed, he did. He is on treatment now and making changes in his eating habits and is doing much better.
Yes, those are classic symptoms. And there are some other symptoms that can also include frequent skin infections or just itchy skin, being slower to heal from cuts and bruises, erectile dysfunction in men, vaginal yeast infections in women, and even a fruity smell on the breath.
Let's talk about the two types of diabetes.
The first type used to be called insulin-dependent diabetes mellitus, or juvenile onset diabetes, but we now just refer to it as type 1 diabetes. Type 1 diabetes develops when the body's immune system destroys beta cells in the pancreas, the only cells in the body that make the hormone insulin that regulates blood glucose. Type 1 diabetes is much less common than type 2 diabetes. About 5 to 10% of people with diabetes have type 1. The second type of diabetes used to be called non-insulin dependent diabetes mellitus, or adult onset diabetes, but we now call it type 2 diabetes.
Type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes. It usually begins as insulin resistance, a disorder in which there is initially a normal amount of insulin, but the cells cannot get insulin to pass through the cell wall to be able to be used properly. As the need for insulin rises, the pancreas gradually loses its ability to produce enough insulin. Type 2 diabetes is increasingly becoming diagnosed in children and adolescents, so it is not just type 1 that occurs in younger people.
But the good news is that treatment for diabetes is improving all the time, thanks to ongoing studies and clinical trials and research.
And the really good news is if you are proactive in preventing diabetes, you don't have to get it and suffer the debilitating effects it can have on your eyes, feet, teeth, heart, and lungs.
Remind us again how you can prevent diabetes.
It's all about healthy lifestyle choices, a lot of which we covered in the first 4 podcasts on strengthening your immune system. If you exercise regularly, maintain a healthy weight, eat fruits and vegetables and whole grains, avoid junk food, you are well on your way to avoiding diabetes.
Great advice. Remember that 30-minute daily walks that we mentioned that can prevent so many diseases, it also helps prevent diabetes.
There are some great resources available to you if you need help changing your lifestyle habits. One is the Lifestyle Change Program offered through CDC, the Center for Disease Control. They have coaches that you can access online.
And you can access a test to learn your diabetes risk at diabetes.org. They also have tons of educational material available on these websites. You can find the links on our documents listed in our Compassion Link website.
We encourage you to be aware of this chronic and sometimes deadly disease. Know your risk. Know your numbers by getting your blood sugar checked. And know the symptoms you can recognize and get help as soon as possible. If you control your blood sugar early on in the disease, you can prevent so many problems.
On our next podcast, we'll talk about how to control those blood sugars if you already have diabetes so that you can live a longer and healthier life.
Thanks for listening to Hints for Health today. Join us again in the future for this series of podcasts that will help you in your goal of optimum health. This series is created and produced by Compassion Link, an Assemblies of God World Missions International ministry. I'm your host, Neil Ruda. For more information, visit www.compassionlink.org/hints for health and follow us on social media. God bless you.